Dan.
Thank you.
Good morning, everybody.
Good morning.
Thank you for being here, which I think truly demonstrates your interest with regards to aging issues, and as you're faced with having to make difficult decisions about where you're going to kind of stretch that dollar, I think this is a perfect example of how we can really deliver more services with fewer dollars through home and community-based services. You know, when I started 30 years ago, aging was somewhat of a concept, an enigma. Well, you know, I'm fast approaching part of these demographics here, and not to mention that, you know, I've also experienced being a caregiver for my mother and having to look for resources in the community to help her stay as independent as possible. So it has a much different meaning to me today than it did 30 years ago. And it's something that we're all going to experience, whether it's with our own aging process or with helping family members or children that are really looking at resources to take care of their parents. So, quick overview of the Seniors Resource Center. We've been around nearly 32 years now, and really started with the concept of bringing a variety of small community service programs together to create kind of a one-stop shop. Excuse me for having my back in the K while I'm standing here in the middle. Bringing a variety of community services together to kind of create a one-stop shop, a point of entry where older adults, family members could come for information, for resources, and for direct services. Since that time, the Seniors Resource Center, when I go ahead, you know, has really evolved into a comprehensive service provider. And there again, recently we kind of revised our mission because, you know, we recognized that we were creating a number of community partnerships, that we were not only addressing older adults, but we were also supporting the caregivers, younger caregivers. We have volunteers ranging in age from probably 5 to 101. And we're also serving younger developmentally disabled who can benefit from a number of our services. But our focus is really person-centered, that we're focused on the individual and determining solutions that support their ability to remain living as independent in the community with dignity for as long as possible. Also, our vision statement is really recognizing that we often talk about the continuum of care. Well, it's not linear. You know, depending upon you know, one's health status and needs, we like to look at it as a constellation of services with the individual being in the center, and that they may access a variety of different community resources depending upon, at that stage in their life, what they are needing. So, having really started in Jefferson County, having our roots in Jefferson County, one or more of our services are now represented in these 12 counties. And you know, a lot of that is the simple fact that the demographics that Jayla had spoke about is really, you know, driving the need for more community-based services. So we look at opportunities to develop partnerships, public-private partnerships with municipalities, with counties, to try and meet their needs and come up with solutions to deliver those services. You can see here in 2008, we provided direct services to more than 17,000 individuals, older adults and younger developmentally disabled. So our core services include transportation. You know, we provided about 135,000 trips last year, utilizing our fleet of vehicles and our drivers, as well as brokering transportation, identifying other community resources and putting those into service, as well as developing a volunteer driver program. So we have about 50 volunteers that are providing more than 5,000 trips in a given period. Adult day and respite care, we have 5 different locations where People can come and spend the day with us. They're living with family members, so they need some supervision, they need socialization, they need some stimulating activities. They need also some rehabilitative services that can all be provided within this adult day setting. On average, we're serving about 90 individuals a day. Two of our locations are specific to younger developmentally disabled. And we serve probably 70% of those we serve have Alzheimer's and or some other form of dementia. Care management has become an even more important component to our service delivery. Having care managers that can help one assess their needs, determine what community resources are available, and to help them navigate what can be a very complex system of long-term care. And as well as trying to pull together the various funding sources to help fund long-term care. And then volunteer services. We have about 1,600 volunteers that are engaged in our programs and services and working in the community. Sarah?
On your volunteer driver services, do you have folks that work on the weekends too?
We do. We do.
The reason I ask that, what comes to mind for me is I have a couple of constituents who are having a real issue about getting to church.
Okay.
So maybe I should get that information from you. And we tried to work things with RTD, and RTD was trying to work, but I have some constituents at two different churches where they drop them off here and their church is here. Yeah. So let me get some numbers from you if I could.
Okay, all right. And there again, you know, the creation of volunteer services was recognizing that so many of our funding sources limit our ability to provide services.
Yeah, see, we wouldn't be able to play for that, but that's why John does such a good job, is because our dollars wouldn't be able to pay for a trip like that, but
right. And RTD tried to do that, but they were concerned that, well, if they do that to those two churches, then there's 5,000 more churches who would say, oh, well, come and bring our folks here. So.
Right. So about 1,600 volunteers. And, you know, I mean, there's been a number of studies showing that there's a direct correlation between volunteering and one's health status. Mm-hmm. And so this is a way to engage older adults to feel, you know, as if they're still very much a part of the community, as well as, you know, tapping into this incredible resource of knowledge and skill sets and their ability to give the time needed to help, you know, address community needs. Job training. So we have one or two contracts in the state to provide job training services for older adults over the age of 55 that you know, are low income, and to put them into nonprofit and governmental entities where they can receive on-the-job training, and then to assist them in finding meaningful employment. And of course, as you can imagine, that's rather challenging today. But nonetheless, this provides a wonderful opportunity for older adults to continue to work, and you know, what we're able to pay them helps to supplement their Social Security, as well as, you know, help to cover the cost of prescription drugs or other basic needs. Mental health is a key component, and there again, we try to take the approach of looking at